Hi, Facebook. Thank you so much for tuning in to my videos. I absolutely appreciate it. And, the commentary and the questions that I'm getting are absolutely perfect. So please don't stop and keep them coming. So today's going to be a little bit different because this is not a question that I was asked, but this is something I woke up and saw on the news and I felt I should address or get ahead of because maybe folks are thinking this right now. So here's what happened. I woke up and I saw a news story that said folks taking ibuprofen should not take it because it could potentially cause a severe form of COVID-19. Where did that come from? And so I was concerned, so I wanted to do some research and figure out what's really going on. So I'm going to use this video and this time to separate fact from fiction on taking ibuprofen or other ACE-inhibiting drugs. Now, where did all this come from? About a day ago, the World Health Organization released new guidance that said folks that are experiencing signs and symptoms indicative of COVID, like fever and coughing and sneezing and chills, all of those things should not take ibuprofen or other NSAIDs, non-steroidal anti-inflammatory drugs, but should take acetaminophen instead because they're unsure about this severe form of COVID. Now, where did that happen? How did the World Health Organization come to that conclusion? Well, about 7 days ago, there was a research paper that came out of Greece that was tracking patients that were already infected with COVID. And in this very small population and very limited study, they saw that folks that had underlying illnesses such as diabetes type 1, type 2, cardiovascular disease, hypertension or high blood pressure, or cerebrovascular disease, and they were taking an ACE inhibitor, which NSAIDs are ACE inhibitors, so ibuprofen is an ACE inhibitor, that these patients developed a severe form of COVID. Now, again, there's lots of debate that's going on. Other scientists are saying, wait a second, this is still a very limited study. What's really going on? And let me describe this a little bit so you understand what ACE is and what's really going on. So give me a second. And bear with me because there are some big words here. So basically, ACE is angiotensin converting enzyme 2. And this is an enzyme that's found on the surface of our epithelial cells. So these cells line our blood vessels, they line our respiratory tract, they're on our kidneys and in our liver as well. And so when we take these ACE2 or ACE inhibitors, what happens is that we restrict the production of ACE, but we allow the production then of ACE2 on the surface. The virus COVID-19 has been shown to use ACE2 as a receptor to bind to cells and also cause infection. So, in some cases, we're seeing that patients that are already infected and taking these ACE inhibitors may have a severe form or develop a severe form of COVID. Now, again, this is still very early data and we're still trying to figure out what's going on here. And this is why the World Health Organization has released this guidance. Now, is that saying stop taking all ibuprofen? Is that saying stop taking all of my medications that may be ACE inhibitors like lisinopril or other high blood pressure medications or my type 1, type 2 diabetes medications? Absolutely not. Do not stop taking those. Because what's going on, and here's the bottom line, what's going on is that the majority of people, the majority of Americans, if we continue to practice these good, safe distancing, social distancing, if we wash our hands in warm soap or warm water and soap, then we severely decrease the probability of us becoming infected. And if we're still having these underlying illnesses and we remove ourselves from this, then we may wind up in the hospital for something that has nothing to do with COVID. So please continue to take your medications. Now, if you feel that you're getting sick, if you're feeling some of these symptoms, contact your primary care physician immediately. They can walk you through through and identify maybe a different treatment path for your underlying illness. They may move you to a calcium channel blocker, which we haven't seen some of these same effects, or they may move you to something else, but don't take it upon yourself to self-medicate and do these certain things. Have these very intimate conversations with your physician. Do not remove yourself from these medications. Now, at the end of the day, as I keep saying, washing your hands and doing these common sense hygiene is the best way to keep everybody safe. And you want to continue to do the things that you're doing for your own personal health as well. I know this is trying times. I know we're getting so much information from so many different sides. It can be confusing. It can be frightening, but it's okay. We're all going to get through this together. Come back, ask me, ask scientists, ask your physician, absolutely, on what's the best path forward for me. Everybody's different. So don't believe everything that you're reading and hearing in social media or on the news. You can certainly come check it out with me, or you can check it out with your own primary care physician. I've tagged some in this post. I invite them to chime in and also give their commentary or their thoughts on this particular story as well. And we'll all get through this together. Thank you so much for listening. Again, there are other questions. I'm going to answer them soon after this. So stay tuned for more videos. Stay tuned for more commentary. Thank you so much for asking your questions and continuing to ask this scientist and asking me. And thanks for tuning in to Ask Dr. Al.